Nick Hulscher, thank you so much for joining us today. We appreciate you being here.
Thanks for having me.
It is great to have you. Well, you are probably the number one person I want to talk to about the announcement this week that the CDC is no longer recommending the COVID injection on the immunization schedule. But the key words here are for healthy children and healthy pregnant women. Give us your take on this announcement.
Yeah, so this is a positive step in the right direction. I must say that giving these mRNA shots to healthy pregnant women and healthy infants was an absolutely ridiculous policy choice by the previous administrations. And it was an absolute disaster. So finally, we do see it being removed for those select groups. But where I'm concerned, and I am still majorly concerned, unfortunately, is that these mRNA shots are still going to be recommended to what they call our high risk Americans. Now, who's high risk? Actually, a majority of Americans are high risk. And what that means is, and actually who falls under high risk is pregnant women with comorbidities, so-called unhealthy pregnant women, infants still, so 6-month-old infants with diabetes or obesity, with a high BMI, will still likely be subject to these mRNA shots. And this was all outlined in the FDA's policy statement in the New England Journal of Medicine last week, where they did indicate that they still will be recommending the mRNA shots for this large portion of America. And so, in my opinion, these shots, these mRNA shots that have now been linked to mass harm, mass death, disability among Americans should not be being given to any age group. Nobody is spared from their life reducing and disabling effects.
Very, very good and strong point. We just aired a clip of Mike Johnson yesterday for our audience, speaking to a woman who lost her daughter due to the Pfizer injection. And he acknowledged actually that this is a widespread problem across the country. And of course, was sympathetic to this woman's story. But then he proceeded to just go on about how the Biden admin censored all these people. And it's like, okay, that's all well and good. We know they did that. But what are you doing about this right now? This woman is standing in front of you. She's telling you her daughter's dead. And his response was, we're going to have a couple of hearings. We've got upcoming hearings. And my whole thing is, Nick, we have so much evidence now that these are causing harm, that these are causing death. In fact, just the other day, I saw Dr. Peter McCullough in a hearing with Senator Ron Johnson. Fantastic effort, of course, from Dr. Peter McCullough. But towards the end of that, and I sincerely hope I heard wrong, Senator Ron Johnson said we can expect to have more of these hearings, and we're probably not going to get to the bottom of this for at least the next 2 years. And I hear that, and it makes the hair on the back of my neck stand up. What do you mean 2 years? We've been compiling evidence of these harms for 5 years. We don't need more hearings.
Right, right. Well, yeah, we do wish that, we don't need any more hearings. We don't need any more deliberations. Honestly, we do have thousands upon thousands of peer-reviewed studies now that just demonstrate the harms and the harm that has been incurred among the world. Now, I do applaud though Senator Ron Johnson, for putting these together, because he does seem like the only one of the only senators that actually does care and wants to do something about this. So, I do applaud him for that, and I do, I am a fan of him very much so that he is trying to do these investigations. But yeah, but you are right. We do already have the evidence, and so these shots should have been pulled off years ago.
Well, let's talk about some of this evidence. You recently published this, and I just want to bring it up for the audience. Pardon me, one moment, make sure it's visible for everyone. Pfizer mRNA shots alone likely responsible for over 470,000 American deaths, according to an MIT Florida Surgeon General study. Talk to us about this, please.
Yeah, so this study, it's in the preprint server right now, but it is a very robust study. It will be published shortly. And yeah, Florida Surgeon Joel Ladepo is the senior author. They looked at the, I believe, Medicaid data. There was over 1 million Florida adults included in this study. And what they found was those who received Pfizer compared to Moderna injections faced a 37 or 36% higher risk of all-cause mortality not due to COVID-19. So what that means is if you extrapolate it, and Steve Kirsch was the first to do this, if you extrapolate that estimate to the whole all of America, and you look at how many people got the Pfizer shots, and the number actually does come out to 470,000 American deaths from Pfizer alone in the first year of the mRNA campaign, so in 2021. So that is a minimal estimate. This number is so large, it is rivaling the death toll of World War One, World War II, and the Vietnam War combined for American casualties just in that first year. And so this is such strong evidence now, and we can only imagine how much Moderna killed, right? This study didn't compare to an unvaccinated control group, unfortunately, so we can't estimate that from this study. But regardless, this also does corroborate the VAERS extrapolation estimate death toll, which is actually 600,000 American deaths based on an underreporting factor of 31. But again, these are conservative estimates. We are likely in the millions for American deaths.
Okay, so we're just looking at this. MIT Florida Surgeon General study indicates Pfizer mRNA shots alone likely killed over 470,000 Americans. And again, we're talking about in the first year alone. This is really, really shocking to me, Nick. I just, again, I feel like I have to keep harping on about this. A moratorium at bare minimum, like when I listened to Speaker Mike Johnson acknowledging, yes, we know that this has been a problem. It's widespread all over the country. We need more attention on this. Well, if we know that as a bare minimum, if we acknowledge we need more investigation, even the acknowledgements from Secretary Kennedy, we need to look into this more. Marty Macri, we need to look into this more. Okay, if you need to look into something more, then isn't a moratorium what's needed at this current point in time? Of course, our view is a complete ban, but now, right now, these acknowledgements mean moratorium.
Yes, exactly. I mean, we are acknowledging now, and now we saw firsthand proof, in the testimony. Dr. McCullough laid out the autopsy study that found 73.9% of deaths after COVID-19 vaccination are due to COVID-19 vaccination, and a causal link between these vaccinations and death. And there's still no black box warning. There's still no acknowledgement that these injections can cause death. And this was really concerning and indicates that there is still an ongoing cover up. There is still an ongoing effort to push mRNA products on America, and they are ignoring all of this evidence.
Yeah, I'll bring up Moderna's pipeline for everyone in a moment, once we're done talking about this, because you look at a pharmaceutical giant like Moderna who's still in the process of developing all of these, and it makes sense why there's an ongoing push and a cover up when you see how many of these products they're still developing. But I want to talk to you first about this other study, because I know that Ed Dowd posted about this. He's like, so many people are saying this is basically an extinction level event. COVID mRNA shots destroy over 60% of women's non-renewable egg supply. Explain to us what this means.
Yeah, so this really, this really hurt me when I read this study, and it really has grave implications for humanity. What they did was nobody's bothered to do it yet that we're aware of. So these are the first researchers that did this. They're in Turkey, right? So honestly, I'll say first, those out of studies out of Middle Eastern countries are actually the least biased, and they actually find the harms because they're not captured by Pfizer and Moderna. But so what they did was they injected rats with mRNA shots, inactivated COVID-19 vaccines, and placebo. The rats that got injected with mRNA shots literally lost over 60% of their primordial follicles. And so this is, in other words, the ovarian reserve of these animals, which is the finite egg supply of women that does not regenerate. Women are born with this finite amount, and that's all they've got. So now you wipe out 60%. That is horrible. And we do believe that this rat study does indeed translate to humans, because another study did come out by Manichi and colleagues out of Denmark. They actually looked at the Czech data, the Czech Republic, and what they found was that over a million people, and so another huge sample size, those that received mRNA shots had 33% fewer successful conceptions than the unvaccinated population. So we see it in human data, we see it in the experimental data. This indicates that because they're still being administered to people all across the globe, that there are population control operations ongoing. And one last thing about those operations is 35% of countries actually admit to conducting population reduction operations. So this is very worrisome.
And here's the other thing. So whenever I hear these studies, I talk about the impacts on the injected versus uninjected people, and how we obviously see less, horrible outcomes for the uninjected population. But by the same token, I want a comparison, and maybe, if they've done this or they just haven't gotten around to this yet because we're still trying to stop these shots, what uninjected populations were like prior to the rollouts and after, because of the issue of shedding. Nick, this is one thing that's largely ignored. It's like, oh, okay, well, no one's really getting them anymore. Yeah, but a lot of people who chose not to get them lost their livelihoods, lost their jobs, their careers, their social media accounts, absolutely everything. Some people even targeted by their banks for speaking out about this, were shed onto. And this was against their will. Where is their informed consent?
Right, they have none. Unvaccinated populations, those who decided and made the wise choice to not receive an mRNA product, were still subjected to shedding of those who decided to get it. And this violates the informed consent principles, right? It's not our choice, right? I didn't receive an mRNA shot. I don't want to, be inhaling spike in exosomes. I don't want this mRNA to somehow reach my circulation, which is definitely possible based on a study by Sue Peters and colleagues. They actually found that women in close proximity within 6 feet outside of the household to vaccinated individuals did have menstrual cycle abnormalities significantly increased. So what that means is they did likely get shed on. And this was the first study to kind of show that this might be able to happen in real world settings. And so we need more study on this. And in the meantime, we got to get the shots off the market so we're not violating people's informed consent.
It's interesting that 6 feet. I wonder whether, because Fauci openly admitted there was no science behind the 6 feet rule, I wonder whether that had to do with the control group of the worldwide experiment in some ways. If you're saying that there was a 6 feet, within 6 feet, that the shedding was affecting them. Just a side note. I don't know whether there's anything to substantiate that.
Well, honestly, that study, I think they just picked 6 feet as a point, right? They
Okay.
could have looked at 3 feet, 4 feet, and it would have made maybe a slight difference. But yeah, there's nothing particular about that 6 feet point that they picked.
Right. Well, again, I think that this study is very important for people to become familiar with. Have a look at Nick Hulscher's Substack, Focal Points. COVID mRNA shots destroy over 60% of women's non-renewable egg supply. But again, we're only looking at the effects of those who really got the injections. We're not comparing pre-COVID levels of women's fertility to post-COVID levels of women's fertility who didn't receive the shots. We know that global fertility is a problem all over the world, and it's affecting, I can tell you anecdotally, Nick, that it's affecting women who did not receive the injections as well. So I just cannot understand how this gross experiment can continue in any way, shape, or form. There is one more study that we want to talk about right now. Mass mRNA injection campaigns likely fueling the global fertility collapse. Sorry, that was another article that you wrote about this. So among 1.3 million Czech women aged 18 to 19, those vaccinated against COVID had 33% fewer successful pregnancies compared to unvaccinated women. So this is what you mentioned before, right?
Yes, yes, that's what I mentioned, and that's the human data standpoint. Because so we looked in the rats, destroyed the rats' ovaries, destroyed their eggs, And so this indicates that this is happening in humans as well. Really, I mean, that is a large reduction in successful conception rates. And that is so worrisome. That's basically the first study that had such a large population size that did compare these unvaccinated to the vaccinated. And it's just extraordinarily worrisome. This is likely going to be seen worldwide, especially in those countries that did administer mRNA shots to their populations.
And we have at this point no real indication of how long this is going to go. Do we have any data, Nick, of how whether this is over time causing more damage to fertility? We know that the spike is proliferating throughout the body. In some cases, 1.5, 2 years after the person had the shots, according to autopsy data. Is it accumulating more and more over time? Is this problem of fertility going to get worse?
It's possible it's going to get worse. It's not rebounding to where it should be rebounding based on the global fertility data. So, it is really tanking down. And it honestly, it was tanking down before the pandemic. But when you introduce fertility and destroying injections to the majority of the population, it's going to accelerate that decline. And now we do see drastic accelerations of fertility collapse. And we're worried about the long term implications because we now understand that these mRNA shots likely do, in fact, integrate into the genome. We now have three independent sources indicating this. One is by Alden and colleagues. This study literally looked in the test tube in a human liver cell line. They inoculated it with Pfizer, and it literally reverse transcribed into DNA in 6 hours. And then we have Neo7 Bioscience and University of North Texas collaboration, along with McCullough Foundation collaboration. We did identify what's called molecular chaos when analyzing the blood of vaccinated individuals. All sorts of gene expression points were going haywire in these individuals long time after injection, as well as detection of SV40 and spike related components long after injection. And then we have the Inmodia lab in Germany has detected SV40 spike vaccine mRNA in human tissues years after injection. So we do conclude now at this point that it is most definitely reverse transcribing into the genome in at least some people who receive these shots. And that could mean that they become forever spike production factories.
Well, what else can it mean? Because, and I don't mean to get too theoretical here, but we know that we have clear messages from some of the people who are really huge fans of transhumanism talking about, modifying the human. They call it gene therapies, really much more palatable than, editing the human, changing you from your original, God's design. But what does it actually mean to have something reverse transcribing into the DNA in the long term? Is it only spike protein, or is there something else that they're trying to change here?
Yeah, so in cells that do receive this mRNA and they do uptake this Pfizer mRNA, and it does reverse transcribe, those cells or whatever organ that was transfected will literally just keep producing not only spike, but what's called frame shifted proteins. These are proteins that, the mRNA isn't read correctly, because the mRNA is not perfect, and then it's going to reverse transcribe, and you're going to have all sorts of non-human proteins being produced as a result of this. And this is reflective now in what we see now with these white fibrous clots. There's now been abundant analysis into what these are, those massive clots that are so long. Nobody's seen them before the pandemic. And regarding those clots that look, like from a science fiction movie, those are now believed to be what's called amyloidogenic misfolded proteins, right? So it appears that these mRNA shots are actually inducing protein misfolding. And what that means is, and also they used what's called the RT quick test, which indicated that these misfolded proteins may be what's called infectious amyloids. In other words, these exhibit prion like activity to where when these misfolded proteins come into contact with healthy proteins, they can trigger misfolding in the healthy ones, and it can become a chain reaction. And that's possibly why we see these large clots. And I know a recent genetic analysis of these clots by Kevin McKernan. I know he found that these are indeed human origin, right? So it is our own body, making these clots, and so this is very worrisome. And we also know from the global embalmer surveys by former Air Force Major Tom Haviland, he found that 82% of embalmers are now seeing these white fibrous clots worldwide. Very concerning. This needs further investigation.
So what I've heard from people like Richard Hirschman is he's now finding, and embalmers around the world are also finding these inside of uninjected individuals, these white fibrous clots. And my question is, okay, if this is first, if you can explain to people what misfolded proteins are, and is this something that can also be a product of shedding, or is it, as Richard Hirschman said, in the cases that he's found, it's because they received a blood product, for example, a transfusion or something like that? If we can just get your thoughts on that.
Well, it appears that this spike protein or any other proteins that are being produced by the body, it does appear to affect protein mechanics. So basically, literally, it makes your proteins misfold, right? So just think, they're not operating like they should be, and then they start basically deforming and infecting other proteins around it, and it's just a disaster. And unfortunately, we don't really know enough about this pathology to really expand on what exactly is happening here. But we do see the physical manifestations, and we do see the microscopic analysis, the genetic analysis, that does indicate that these clots, it really is something novel, and it does appear to be fatal in people. It does appear to cause death.
It's very strange to me that we're acknowledging things like, okay, sometimes there's heart inflammation or myocarditis, and it seems to be this slow drip that's coming out of, the health authorities right now. And again, that's more than we had before, but still not far enough. And I'm just wondering if this is something like infectious amyloid, and this is something that could potentially be happening in uninjected people as well. What can infectious amyloid lead to, and what do the authorities really need to be looking at here, Nick?
Right. Well, I guess if you think of mad cow disease, it can be something similar to that, and just literally result in the destruction of your vital organ systems. And who knows if these clots seem to be blood borne, so they're in the blood, and then they just grow and grow and grow until an artery is blocked off, and you get a heart attack or something along those lines. And so again, we don't know exactly, but this is something, this whole anomaly with these clots, this whole situation has really kind of been ignored for the past few years by basically a large portion of not only our regulatory agencies, but it's never been reported on in mainstream media at all. And if it's really in 82% of corpses, that's bad, right? How many living people are these in? So we got to start, developing tests to measure, to see how many living people is it in, and how can we remove these? And what exactly are they? Again, we do have to get to the bottom of this.
Yes, especially because, and again, anecdotal, but we're hearing stories of people having a transfusion, and it's appearing inside the transfusion. We've heard stories of surgeons, again, these are all sort of anonymous because everyone's still very scared to talk about this, but during surgery, performing surgery on a live patient, they're finding these inside of them. So I am very concerned about this. I'm concerned that no one's talking about it. Yes, it's all well and good to admit that there's some, fluttering hearts out there, but we have something that seems a lot more pressing. If we're talking about something, and I recall, Nick, and maybe you can speak to this, conversations with Dr. Stephanie Seneff from MIT very early on, and she was saying there's a lot of things that we're seeing that's sort of prion like, or, similar problems with the brain and the cognitive function of individuals who've been injected. And perhaps this is something that isn't getting anywhere near enough attention as well. We're looking at some of the physical things like heart problems or immediate death, which is tragic as it is. But what about the people that are still alive with cognitive impairment? What do we know on this?
Yes, we have multiple studies now indicating severe behavioral changes in those who receive mRNA shots. And that's because now a study by Ota and colleagues that found the mRNA, vaccine mRNA, and spike protein was being produced in cerebral arteries of stroke patients. We know the mRNA shots, based on the second largest COVID vaccine safety study ever conducted with 85 million people in it, they found 200% increased risk of stroke in after dose 2 of mRNA shots. So we do know it goes to the brain, causes brain damage, neuronal destruction, and that is reflective onto neuropsychiatric conditions. That was found now in a study by Dr. James Thorpe and colleagues. They actually identified 86 neuropsychiatric safety signals for these COVID shots. They compared flu shots, the prevalence of those, or the number of those adverse events reported to VAERS compared to the COVID vaccine adverse events reported to VAERS for neuropsychiatric conditions. And they found literally 86 of them, including homicide, homicidal tendencies, psychosis, schizophrenia, Alzheimer's, cognitive impairment, um, violent behavior. All of this stuff was found to be in far exceedance of what was reported with the flu vaccinations. And so this is so concerning. And this also corroborates multiple other studies. One out of Korea that found increased Alzheimer's risks, increased cognitive impairment risks. And also another study, I believe also out of Korea, found massive increased risks of depression, sleep disorders, and anxiety from these injections. And so we clearly now know, based on the peer reviewed evidence, it damages the brain, causes brain damage, resulting in neuropsychiatric conditions.
All of these things that you're mentioning now just make me think of this announcement, and you know, it's common sense and it's good science. And personally, I find this, you know, when we have so much science about around how dangerous these injections are, I find this to be really lacking. I understand and again applaud them for taking these small, very, very small steps towards, you know, whatever it is that they're aiming to do here with the COVID injections. But I just cannot fathom or justify or find any sort of justification. It's been well over, you know, a few months now that President Trump has been in office, and if we're talking about making Americans healthy, this is the only solution is a moratorium on these injections. Like there's nothing else really that satisfies. How do you feel about the public sentiment around this? I know people are sick of talking about this. I'm personally sick of talking about this. I'd love for the authorities to just do the right thing. What do you think the public sentiment is out there about all of this, Nick?
Right, we've been fighting this fight for years now, and yeah, we don't want to talk about it anymore. We want this off the market. We want to finally, have people safe from these reverse transcribing deadly injections. That's all we want. We're not, that's what we're doing this for. And so, yeah, we want this to happen as soon as possible. We want these injections to be completely removed from the market, a complete moratorium. They've killed too many people. They've disabled too many. They've injured too many, up in the millions in America alone. If you ask anybody do you know somebody that's been injured or killed by the shots? They will tell you yes. And many people can attest to that. Many surveys, Rasmussen surveys, can attest to that. And so, what the public sentiment is, based on social media, looking there, is people want these off the market for everybody. They're not getting tricked anymore. They're not falling for the trick that, oh well, look, now it's off for healthy kids and healthy pregnant women. People see right through that, and they see that, well, hold on a minute, it's still going to be recommended to a majority of the population, and people do understand that. We're not stupid. And if as the longer they keep these on the market, the bigger the black hole of distrust will become.
Very good point. And I suppose, initially when people were crying out loud about this and saying, we can appreciate the focus on, certain dangerous food dyes and things like that. That's all well and good. But we have a bigger elephant in the room and we need to address this. And so initially people were like, just give them time, just give them time. But the longer time goes on, the more it seems that we're not really getting to the root of the problem. I said to everyone that I'd bring up Moderna's pipeline on the screen. This is their, as of May 1, 2025, all categories of their mRNA pipeline. You can see here they're developing more COVID-19 injections, flu vaccines, RSV vaccines. This one is already worldwide, the RSV. You can see phase 3 is 18 to 59, high risk. You can see the phases there. You can see the flu plus COVID, pandemic flu vaccine. Then it keeps going. CMV, EBV, you've got HSV, HIV, norovirus, Lyme disease, Zika. This is your hemorrhagic fevers, Nipah, Mpox, melanomas, renal cell carcinomas, bladder cancer. So it doesn't look to me, Nick, that this is a fading industry. It looks to me like the lack of pressure. And again, just look at this: solid tumors. There's so much here: cystic fibrosis, lots of other injections in their pipeline. And so it looks to me like the lack of action, the lack of accountability for these pharmaceutical companies is the reason why they're still developing so much mRNA technology. This is not a cheap exercise.
Right. They made so much money from the pandemic, from governments buying their products now that it's still being given to people and they just greenlit it, for another round of boosters this fall. Now that that's all happened, they believe that they can just make these mRNA shots for every disease and they want to usher in the age of mRNA. They want every vaccine to be mRNA. And that was just Moderna's, but think of Pfizer's and think of Arcturus Therapeutics, who's developing the self-amplifying versions of these, which was already approved in the EU, in Japan, testing underway, fast track testing underway in America for bird flu replicon injections. And so,
Yes.
yeah, they have all these coming up, and it doesn't appear to be that anybody is stopping them. It appears that they are going to sooner or later, be rubber stamped, and they'll claim, well, because they're high risk, they can get these gene altering shots. We got to get away from that. We got to start listening to Americans, to the public, of what they actually want and what they believe. And, we are tired of this regulatory capture.
Absolutely agree with you. Thank you so much, Nick. We really appreciate you, your fight, your honesty. You are an incredible person to have in this fight. I want to direct everyone to your X account at Nick Hulscher. You can also follow his Substack, The Focal Points, Courageous Discourse. You can find that at thefocalpoints.com. Any other links that you'd like to mention?
That's it. That's it. Yeah. Focalpoints.com, my X account. And you can follow me on LinkedIn if you want and help me combat all the trolls that continuously report all my posts.
Oh, you're still allowed on LinkedIn. That's wonderful. I was banned. I was banned, but that's it just comes with it. I was just posting way too much out there way too early on, but I'm glad that you're still able to get the truth out on LinkedIn, because that's a community that really needs this information, Nick. So hopefully you stay up there as long as humanly possible. Thank you again so much for your time and your fight.
Thanks for having me.